The amount of leeway space in mandible is greater than in the maxillary arch. It is about 1.8 mm in the maxillary arch and about 3.4 mm in the mandibular arch. In maxillary arch 1.9 mm on each side, and in the mandibular arch it's 1.7 mm each side. Breathing is termed anatomic mouth breathing if short upper lip. In peck and peck index, mesiodistal and buccolingual measurements of mandibular central incisor is taken. The angle of convexity is NA-POG. Intramatrix procedure is a rotation of mandibular plane relative to core of mandible. In CAD/CAM, time taken in processing of crown is 20 minutes. Frequency curve or probability curve resembles anti-monsoon. Acceptable marginal fit for single casting is 100 microns. Mitral stenosis is not a feature of pansystolic murmur. Earliest symptoms of acute rheumatic fever is migratory arthritis. Diamond black anemia is another name of inherited erythroid aplasia. Staghorn pattern is seen in hemangiopericytoma. Turnover rate of junctional epithelium is 6 days. The most frequently used pin for pin retained amalgam restoration is self-threaded pin. And when you use pin in the amalgam, it decreases strength. That means the resistance is decreased. Pins are placed usually parallel to the external surface of crown, except on distal surface of lower molars and on lingual surface of upper molars. Ideally, interpin distance should not be less than 3 mm. Secretin increases bicarbonate secretion from pancreas and bile duct. CCK, cholecystokinin, it causes contraction of gallbladder. Now, normal tidal volume is 500. The normal tidal volume is 500 ml. It's normal in and out volume. It decreases in restrictive lung disease and chest disease, and also in respiratory depression as in opium poisoning. Now, inspiratory reserve volume, it decreases in restrictive diseases, and it is normal value is 2 to 3 liter. ERV, it's also decreases in obstructive lung disease, and it's 1 liter. Reserve volume 1.2 liter. It increases in emphysema. MV, it's 50 ml. FRC is 2.2 liter. Now, heparin therapy best monitored by APTT. Vitamin K deficiency or warfarin, it increases prothrombin time. That means if anyone having vitamin K deficiency or is intaking warfarin, his or her PT will increase, and my APTT will increase mildly or normal. In disseminated intravascular coagulation, PT will increase, APTT and BT all are increased. In von Willebrand disease, BT bleeding time will increase, APTT may increase or normal. In hemophilia, APTT will be increased. That was one page. We'll meet in next video. Thanks.